Hello everyone, and thank you for taking the time out to watch my brief educational video. My name is Angela Starks, and I am a caseworker here at Clifton Independent Living Community. Today we'll talk about Georgia, one of our residents. For the past 2 years, Georgia has been a Clifton Independent Living Community resident. Staff members have recently spotted Georgia's changing behaviors. According to them, Georgia has been skipping her midday meals and has left her front door open on several occasions. Georgia has relatives that live roughly an hour away from our village, and they visit her every weekend. Georgia was said to have become confused during their last visit and addressed her grandson Jack by his father's name, David. I glanced at Georgia's medical history and discovered that she is now on medication for high blood pressure and mild arthritis, but otherwise she appears to be in fine physical shape. I've concluded that Georgia suffers from an earlier stage of dementia based on the behavioral changes. This condition is classified as a neurocognitive dysfunction. Dementia is a condition in which a person's cognitive functioning, which is thinking, remembering, and reasoning, has deteriorated to the point where it interferes with daily living and activities. Some dementia patients can lose control of their emotions, and their personalities begin to shift. Dementia can range in severity from mild, which is primarily based on when it first starts to impede a person's ability to function, as it did in Georgia's case. She was suffering from disorientation, forgetfulness, and slight memory loss. Then it goes all the way up to the most severe level when the person is wholly reliant on others for basic daily activities. Dementia becomes more common as people age. About 1/3 of all persons aged 85 and up may have some form of dementia. But it is not a standard component of aging. Many people live well into their 90s and beyond without showing any signs of the disease. Dementia comes in many different forms, including Alzheimer's disease. The symptoms of a person can differ based on the type. When once healthy neurons or nerve cells in the brain cease working, lose connections with other brain cells, and die, dementia signs and symptoms start to appear. While everyone loses some neurons as they become older, dementia patients lose significantly more. Memory loss, poor judgment, and confusion are just some of the signs and symptoms of dementia. Speaking, understanding, expressing thoughts, and reading and writing are all difficult tasks. Dementia begins to affect those abilities. Getting lost in a familiar neighborhood, having difficulty managing money wisely and/or paying debts, frequently asking the same questions, referring to everyday objects with strange terminology, completing routine daily tasks begin to take longer, loss of interest in everyday activities or events, or even losing in a balance and experiencing movement issues can be symptoms of dementia. Alzheimer's and associated dementias have a variety of causes depending on the types of brain abnormalities that are present at the time. The majority of dementias progress slowly and cannot be reversed. Treatments are aimed at lowering symptoms and slowing the development of the disease. Some drugs can help slow the progression of symptoms and treat related diseases like sadness and agitation that come with dementia. No prescription has yet demonstrated the ability in treating cognitive decline. The medication may assist in delaying the progression of the disease, but it does not help restore memory loss to pre-disease levels of performance. Doctors may conduct several tests to diagnose dementia because no one test can do so. A patient or a patient's family may be asked to provide a complete family medical history, or the patient may be subjected to any or all of the following tests or a combination of them to properly diagnose the disease. Those tests include laboratory examination, physiological examination, cognitive and neuropsychological tests, MRIs, CT scans, and a neuro exam. I recommend that Georgia get a full workup, which could include a physical checkup, a neuro exam, a CT scan, and a cognitive and neurophysiological test. I also recommend that the family visit as expected, and I urge that they exercise tolerance and understanding throughout this period. Family support, a healthy diet, exercise, rest, and prescribed medications should make this condition easier for the patient and her family. It is critical to recognize symptoms early, since some factors can be treated. Early diagnosis might help you or your loved ones manage your health and prepare accordingly. I want to thank you for taking the time to listen to me speak today.